goodness.
And I have my sanitizer in my pocket. If anybody comes near me, I have the sanitizer.
Yeah, there's 7.
Okay, well, I'm really glad that was all live. Okay. Good morning. This is March 24th, and this is the Lancaster County Board of Commissioners staff meeting. My name is Sean Flowerday. I am the chair of the Lancaster County Board. On my left is Vice Chair and Commissioner Rick Vess and Commissioner Deb Shore. On my right is Commissioner Roma Amundsen and Commissioner Christy Yoakum. Please rise and join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Mr. Clerk, please begin.
A copy of the Nebraska Open Meetings Act is located on the wall at the rear of the hearing room. Additionally, a copy of all written material to be discussed at today's open meeting is available from the county clerk staff at the front of the hearing room. The material can also be viewed on the county's website at lancaster.ne.gov. Agenda item 1 are minutes. First is the approval of the minutes of the Board of Commissioners Continuity of Operation Planning meeting held on Tuesday, March 10th, 2020.
Move approval.
Second.
We have a motion and a second. Is there any discussion? Please call the roll.
Shore,
Yes.
Amundsen,
Yes.
Yoakum,
Yes.
Vest,
Yes.
Flowerday.
Yes.
Motion carries 5-0. Next is approval of the minutes of the Board of Commissioners Zell retreat held on Tuesday, March 17th, 2020.
I move approval.
Second.
We have a motion and a second. Is there any discussion on this? Please call the roll.
Vest,
Yes.
Shore,
Yes.
Amundsen,
Yes.
Yoakum,
Yes.
Flowerday.
Yes.
Motion carries 5-0. 1C is approval of the minutes of the Board of Commissioners meeting held on Tuesday, March 17th, 2020.
I'll move approval. Second.
We have a motion and a second. Is there any discussion? Please call the roll.
Yoakum,
Yes.
Vest,
Yes.
Shore,
Yes.
Amundsen,
Yes.
Flowerday.
Yes.
Motion carries 5-0. Number 2 are claims. Approval of all claims processed through March 24th, 2020.
Move approval.
I'll second.
We have a motion and a second. Is there any discussion? Please call the roll.
Amundsen,
Yes.
Yoakum,
Yes.
Vest,
Yes.
Shore,
Yes.
Flowerday.
Yes.
Motion carries 5-0. Next is number 3, consent items. These are routine business items that are expected to be adopted without dissent. Any individual item may be removed for special discussion and consideration by a commissioner or by any member of the public without prior notice. Unless there is an exception, these items will be approved as one with a single vote of the Board of Commissioners. These items are approval of amendments on the following contracts. C-15-62 with Summit Foods LLC for annual service food services for correctional facilities. C-17-295 with Platte Valley Equipment for annual services rental of 4 two-wheel drive tractors. C-19-491 with Interspace Studios Limited for Lancaster County Assessor's Office remodel. C-19-304 with Safety Clean Systems for annual services, parts washer services, recycling solvent. Right-of-way contracts for the following. Michael W. and Mary E. Cords, 11400 North 14th Street, in amount of $4,359. Frankie Farms, Inc., 2500 South 176th Street, in amount of $1,271. Kelly Burton Smith and Carrie L. Smith, 1920 Branch Elk Road, in the amount of $1,271. Utility permit with no cost to the county for the following. Number 1947, allowing Lower Platte South Natural Resource District to install 2 monitoring wells adjacent to the east and west right-of-way lines of Southwest 12th at the intersection of U.S. Highway 6.
I move approval.
I'll second.
We have a motion and a second. Is there any discussion? Please call the roll.
Shore,
Yes.
Amundsen,
Yes.
Yoakum,
Yes.
Vest,
Yes.
Flowerday.
Yes.
Motion carries 5-0. Next is number 4, new business. 4A is a resolution in a matter of transferring appropriations from the general fund miscellaneous budget to the general fund county court, general assistance, and election commissioner budgets. The amount to be transferred is $1,098,905.
All right, good morning. Dennis Meyer, County Budget and Fiscal Director. This is kind of the first resolution as we go through the remaining part of our fiscal year, and this is just kind of cleaning up items. A couple of the items we've been talking about since mid-year, the county court and the general assistance. Those numbers were both projected. I think the county court's at the 400,000 and the general assistance is at 300. That was the numbers that were projected. They're still kind of on pace for that. There are a couple larger ones that affect their budget sooner than later. You'll see me back in probably May to clean up the remaining piece, but these items need to take place now. The election commissioner is really based off of the LPS school bond election that wasn't budgeted for. That piece we do get reimbursed for 100%. And then we've got an amount built in for the mailing of all the ballots that we decided last week. So that's where we come up with that little over $1 million.
I would move approval of this resolution.
And I'll second that.
We have a motion and a second. Is there any discussion? Thanks, Dennis.
Yep.
Please call the roll.
Vest,
Yes.
Shore,
Yes.
Amundson,
yes,
Yocum,
Yes.
Flowerday.
Yes.
Motion carries 5-0. B is a resolution in a matter of amending the open meetings policy for the Lancaster County Board of County Commissioners, the Lancaster County Board of Equalization, the Lancaster County Board of Corrections, and all Lancaster County task forces and advisory committees.
move approval,
Second?
We have a motion and a second. Is there any discussion? Please call the roll.
Yocum,
Yes.
Vest,
Yes.
Shore,
Yes.
Amundson,
yes,
Flowerday.
Yes.
Motion carries 5-0. C is a resolution in a matter of authorizing the county clerk to issue payments in the event the county board must adjourn to respond in response to the COVID-19 pandemic.
Move approval?
Second.
We have a motion and a second. Is there any discussion? Please call the roll.
Amundson,
yes,
Yocum,
Yes.
Vest,
Yes.
Shore,
Yes.
Flowerday.
Yes.
Motion carries 5-0. 4D is a contract between Orkin LLC and Lancaster County to provide annual services pest control. The term of the contract is 1 year from April 12, 2020. The cost of the county is not to exceed $5,000.
Move approval?
I'll second.
We have a motion and a second. Is there any discussion? Please call the roll.
Shore,
Yes.
Amundson,
yes,
Yocum,
Yes.
Vest,
Yes.
Flowerday.
Yes.
Motion carries 5-0. E is a contract between Lawson Products to provide maintenance, repair, and operation supplies and equipment. The term of the contract is upon execution through March 31st, 2021, with the option for 4 additional 1-year renewals. Pricing will be pursuant to the ESC contract. The cost of county is not to exceed $12,500.
I move approval.
Second?
We have a motion and a second. Is there any discussion? Please call the roll.
Vest,
Yes.
Shore,
Yes.
Amundson,
yes,
Yocum,
Yes.
Flowerday.
Yes.
Motion carries 5-0. F is a Human Resources Policy Bulletin 2020-1, Emergency Paid Sick Leave Act.
Good morning, Christy Bauer, Deputy County Attorney. Last week at your board meeting, you had given our office direction to draft a policy that would address leave in the event of an employee becoming sick or having to stay home with a child that no longer is able to go to school or daycare. So we had received that direction from the board to work with HR and draft that. In the meantime, as you're aware, there was federal legislation that was passed that provided for paid sick leave in certain circumstances as a result of the COVID-19 pandemic. So what you have before you today parrots that federal legislation that's called the Emergency Paid Sick Leave Act. I would note that there is one area where the county board has decided to be more generous than that policy, and that is in the situation where an employee may be isolated. The Emergency Paid Sick Leave Act will provide for 2 weeks of paid leave, and then the policy before you will provide for an additional 2 weeks of paid, we just termed it pandemic leave beyond that. So I just wanted to point that out to the board. And if you have any questions, I'm here to answer any questions. Doug McDaniel's here to answer any questions. I would also note that the Personnel Policy Board convened yesterday morning and recommended approval of this policy.
Any questions for Christie?
I would move approval.
I'll second.
We have a motion and a second. Is there any discussion?
I just thank you for your work on this and getting it done in a quick notice.
I know it was a heavy lift in a short amount of time. Thank you. Thanks. Okay, please call the roll.
Yocum,
Yes.
Vest,
Yes.
Shore,
Yes.
Amundson,
Yes.
Flowerday.
Yes.
Motion carries 5-0. G is an update on the COVID-19 and Lancaster County response.
The first thing that I would just, to put it on everyone's radar, the Public Building Commission had an emergency meeting yesterday. We authorized the chair to be able to close public buildings with, upon recommendation of the health department. So basically, when the health department gives their recommendation that it's time to close public buildings. Generally speaking, though, I don't know is that that's terribly likely anytime in the future. Only one public building in the country has been closed. That was in New York City. All the others are doing what they can to maybe take appointments, by phone or maybe limit counter hours, but they're still keeping. So there might be some modified operations, but I don't think it's terribly likely. I also, we had a discussion about, I don't think it's within the purview of the Public Building Commission or even the county board really to close the Hall of Justice. That's ultimately going to come down to a decision by the courts, and even then we'd have to be working with the governor for things like firearm permits and sex offender registration, which has to be done. So we'd have to have some kind of authorization from the sheriff there, or from the governor to let the sheriff modify how they're handling operations. So that's kind of the only update that I had from PBC. Roma, was there anything else you wanted to talk about from that?
No, I don't. I think that was essentially it, to be honest with you. There is business that needs to be taken in the county, and the business will be conducted. Some of it is going to be done, through remote ways to do it. But there is business that needs to be conducted within the actual governmental buildings, and we will continue that as long as we possibly can, using common sense measures.
No. Kudos to all our department heads who found alternatives and ways to continue the operation of their departments and keep serving the public at times like this, and yet protect their employees as well. I just appreciate the efforts of everyone who's been involved, and I know we will get through this together.
Mr. Eden, please.
I had a call from Pat Lopez this morning indicating she was going to come down and give the board the latest update. I don't see her yet, so hopefully she's...
Pat and I spoke yesterday, too. I think she was planning it. I don't know if she expected us to whip through the agenda quite this fast. Would anyone be opposed to doing a 10-minute break and then coming back if giving Pat that much time?
I would like to hear from her.
Yeah,
So I
she
think
was-
that would be
she was planning on being
wise. Yeah.
Do we need a motion on that?
Should we go ahead and finish the other stuff on the agenda? And
Oh, in terms of public,
Sure.
Okay.
Sure. Yep.
next is public comment. Those wishing to speak on items relating to county business, non-agenda may do so at this time.
Seeing no members of the public
I
present.
would like to say something.
Oh, yeah, please.
I may not necessarily be the public, but I would like to say one thing that, in viewing some of the, some of the activities that have been going on in the stores and across the nation, I would like to say that one of President Franklin Delano Roosevelt's most famous quotes came during his first inaugural address, and this was in 1933 at the height of the Depression. And that was surely a very devastating event, both economically and emotionally, for the people of America. He said that the only thing that we need to fear is fear itself. And he went on to describe fear as a thing which paralyzes the efforts to counteract the events and to change course, to remedy the situation. And the coronavirus, I think, is one of those sorts of things that does cause fear among a lot of people. However, we all just need to, right now, I believe, we need to take a deep breath, we need to meditate, we need to pray, we need to come together as families and a community, and take action to remedy our situation by taking common sense steps such as a social distancing and the washing of hands, the using of sanitizer, and being calm. I don't think that, paranoia would help the situation at all. We do know that all levels of government, from the national level down to the state, to the county, to the city, to the villages, all have come together to do what they can in terms of helping the economy, in terms of protecting the people. But it is really going to rely upon the individual people right now to take action. We cannot become paralyzed by by fear. So let's continue to do the common sense things, and let's remain calm and help others out, reach out to others by phone, by FaceTime, by Zoom, however you want to do this, by the social media. Check on your neighbors by phone to find out if they're doing okay, and let's move through this together, because quite honestly, this too shall pass.
Well said.
Well said.
Next is announcements. The Lancaster County Board of Commissioners will hold a staff meeting for training to conduct meetings via video conference on Tuesday, March 24th, 2020 at 10 a.m. in room 112 of the County City Building. The Lancaster County Board of Commissioners will hold a staff meeting on Thursday, March 26, 2020 at 8:30 a.m. in room 112 of the County City Building. The Lancaster County Board of Commissioners will hold its next regular meeting on Tuesday, March 31st, 2020 at 9 a.m. in room 112 of the County City Building. County Commissioners can be reached at 402-441-7447 or commish@lancaster.ne.gov. The Lancaster County Board of Commissioners meeting is broadcast live on Link TV City. For the rebroadcast schedule, visit lincoln.ne.gov. Meetings are also streamed live on Link TV and can be viewed on YouTube.
Very good. Let's recess for 10 minutes or so and see if Mrs. Lopez shows up. So. Good idea.
much value.
Well, it is happening. I was ready. It is happening to a certain extent.
Kids get that kind of stuff. I think actually the idea of
So did
disease
he adjust to
you
you
know,
or did
knocking
you
on
adjust
sick
to him?
people makes some sense to me.
I don't know if you've been out much in the community since.
Oh, yes, I have been. Maybe not Saturday, because we actually, you know, I belong to the, you know,
Oh,
Right. Which I used to always do when the kids were little, but I've gotten out of that habit. So when it's just been. Are. A couple of years now.
When do you go on?
the other night we got out.
ready on the right, already in
Yeah,
the
but
middle.
I-
We can
got
take
the
a break
left
and go
brain.
back to business, that's fine.
You ever thought you described yourself as on the left?
The far left.
The
and
far,
Right.
boy, you were barely on
The radical left.
Say, you know what? We better get something through Congress here pretty soon.
Tell me about it. Okay. We will go ahead and reconvene the Lancaster County Board of Commissioners meeting. We have Director Lopez here. Please come on up.
Good morning, Commissioners. I just want to share a little information with you on the current situation and how we're responding from both the city and county side, along with our partners in the community. As you know, we have 2 positive cases in Lancaster County. The first case is travel-related from Colorado. The individual returned on the 9th and became symptomatic on the 15th. This individual tested positive on the 20th. The second case is a household member of the first case, and both individuals are self-quarantined and doing well. There are no locally transmitted cases in Lancaster County. We're currently monitoring, I think it's over 182 people due to their travel history, our exposures. We've had 108 negative cases, and we have 8 pending from the public health lab. There are other labs doing testing, and so we aren't notified until the results come in, whether those are negative or positive, but we know they're happening. And just to give you an idea, yesterday we had 51 confirmed cases in Nebraska. This morning we have 61. So these cases are in Douglas, where 39 of them are, Cass County, where 2 are, Sarpy County increased from 3 yesterday to 6 today. Lincoln County, up North Platte, has 3 cases, Adams 1, and then Buffalo has 2, Dawson 2, Nemaha 1, and now we also have a case in Madison County in Washington. So you can see that our numbers are continually increasing. I wanted to tell you, we've had our incident command system in place since 3/9. We have representation from fire, police, and Lincoln Transportation and Utilities on that board. Health is leading the incident command. We also have members from the county sheriff's office and others involved with that, as well as Jim David Saber and Mark Hoskins. In the operations branch, we're monitoring all lab results and monitoring all people who have travel history or exposures to known positive cases. And that information is shared with the public on a website at covid19.lincoln.ne.gov. So we place a situational update every day there. I know Commissioner Flowerday and Commissioner Adamson heard this yesterday, but that's a place that you can go for current information, and the county website is linked to this information as well, back and forth. And I think it'll be helpful too when the county can place some of the office closings and where to redirect, so we can make sure we're linked that way. So whether the public enters in through the county or through the city, that they have the same information available. We're continuously monitoring every day. In public health, we do this. We're looking at respiratory illnesses, influenza. Our influenza numbers are starting to slightly decrease. But that's been another issue for us in assessing what's happening with COVID-19. In the logistics branch, we've developed an inventory and delivery system for equipment, and you'll hear that the PPE, personal protective equipment. We have requests. We have done a survey. It's all electronic for both city and county entities, healthcare providers, and community organizations that serve those most vulnerable individuals, or for those providers, of course, that are most at risk that we need as essential workforce. So we've had that. We've distributed large amounts of PPE out into the areas where it was really needed. Then apart from all that, we are also working with several community organizations. The Homeless Coalition, we partnered with CHE. They assisted us in helping to do a survey of all the homeless advocacy groups so that we could have a better understanding of what they're seeing as potential needs for them in providing essential service, and for the people that they're serving, and how we can best work with that. And that would include the People's City Mission, Matt Talbot, all those areas. So there was a focused conversation again yesterday based on the findings from the surveys, and priorities are being developed about how we can assist, and who will be reaching out to others to help assist in providing what's needed for them. We've worked with child care centers, and we're keeping a daily we have a resource to be available to them and monitoring what's happening there. We're trying to check in with restaurants and others to see what they need and how things are going during this very trying time. We've worked with both very closely with Bryan St. E's and the surgical hospital. As of last Wednesday, they're no longer doing any elective procedures. And they've been working together. You probably heard and saw in the paper today, Bryan is standing up a drive-through clinic today, but that doesn't mean people can just drive in. They have to have a doctor's order for testing to be done there, and then they're going to both check for influenza and respiratory illness before the COVID test is done. If people come in and they haven't gotten the order, they're doing it at their Life Point site, so people are able to just go right into the urgent care clinic. St. E's is working on a location as well, and I have to say I commend both of our large health systems here, because they truly are working together to do what's best for the people in the community and meet that need. And we're seeing that in every area. We do have the Medical Society is a different branch in this command, but they're working with all medical facilities. So Joan Anderson is fulfilling that role, and with their great relationships with all the providers and health systems, that's helping. An area that we're really concerned about and we'll be doing much more work today is with our long-term care and assisted living we have great feedback from them about what needs to be done, and they're directly involved in developing strategies and solutions. I'm going to just kind of stop there and let you ask questions.
Deb? Then Roma.
And Pat, maybe if you don't know this answer, or maybe it's handled through the LPS component, because I know that they've been messaging with their families too, and you talked about the Homeless Coalition, and made me think about like our new Immigrants Task Force and some of our cultural centers, how confusing all the information is to us in English, and so how that message might be spread to those who are non-English speaking at this point.
Thank you for bringing that up. We have been working directly with the cultural centers, and they've been providing guidance to us on how best to present information and provide it to the people they're serving. We also have a lot of staff at the health department that have been helpful in crafting some messaging. But that is something, and we've been working closely with Lincoln Public Schools. We have contact with our rural schools as well. So thank you for bringing that up.
And don't you have a button on the site?
Yes.
Yeah, COVID-19 site, where it will translate automatically?
Yes, into the appropriate language.
And how many languages do you have on there, do you know? Probably 70-some?
Yes, I think that's probably true. And I also wanted to say, we have up to 18 of our public health nurses. We've redirected that resource, and so we've expanded that so that we can cover the helpline numbers that are coming in. And it's not unusual to get thousands of calls every day, and so that's been really helpful for the community, but it's also been helpful that Bryan and St. E's are also offering things so that we have a variety of ways for people to get correct information in the community and get help.
Very important.
Do you have something?
Did you want to go?
I did have another question. Do you know anything about what's happening at the Veterans Hospital?
Not, that's a state.
The state?
Right.
Okay, just was wondering.
Okay, I do then. Pat, you said we went from 51 yesterday to 61 today. And of course, I think we're all loosely aware of transmission, either through travel and then close contact with family members. And I believe we have 3 community contact cases in the state now at this time.
I think it's more than that.
Has it gone up?
Yes, Omaha has, their numbers have gone up, and I don't know yet, I haven't talked to my colleague in Sarpy and Cass, but I have a feeling some of those are related to a community acquired or a community acquired case.
Okay. And that's really, those are the cases that at this point in time, with our self-isolation and the things we're practicing for this time, those are the cases we're trying to cut down and protect people from.
And we've done some consultation with the Med Center, Dr. Lawler up there, and talking, and also, of course, what we're in contact with Center for Disease Control in the state. But we know that one of the biggest things we can do is this social distancing and having people stay home when they're ill and keeping their family home. That's going to help us maintain our slow, steady development so we don't overwhelm our healthcare system.
My question is, and frankly, it's probably a question for the state and not for you, so feel free to tell me you don't know, and it's for the state. But, I'm looking at it. I've been following pretty closely each day the number of tests done. COVIDtracking.com, go for it. It's right there, and they track every state and how many tests have been done there, and it seems like it's very good data. Our state is lagging behind in tests. You look at New Mexico, which is just, and everyone has heard me harping on the New Mexico test. New Mexico got out ahead of this. New Mexico has almost an identical population base as Nebraska. Statistically, it's a very good analogy for Nebraska. It's got the same urban-rural divide that we have. They've done nearly 6,000 tests now as of yesterday. The Nebraska data is a little bit dated. It's from Saturday. We've done 400. Now, I'm sure that number is probably higher than that in reality because we've probably done more than that. And I'm also betting that this isn't counting tests done in private labs because those are, but, I mean, that goes, but that's going to go for New Mexico too. It just seems like compared to the other states around, North Dakota's done 1,400. It just seems like we're not getting the number of tests here in Nebraska. And I mean, that's very much on the state side. It might not be on your end, but do you have any insights into that? Is there anything you can say on that?
Well, I know that, just getting, there's both the testing supplies,
Yeah.
the kits, and then the medium, and then the reagents. So it gets a little bit complicated. Just in the last 2 weeks, we've had private labs that have become available. And so both St. E's and Bryan are using private labs. I can't answer for those other states.
Yeah, of course.
I know what we were, the CDC guidance that was given was what allowed us to send tests to the public health lab. And so until that guidance changes a little bit, we're fairly restricted in what we can send to the lab. But now that we have other sites available, the only thing with the private labs is when we send them to the public health lab, we have a 24-hour turnaround time. The private lab is 2 to 3 days. So that's a concern, but people are quarantining and self-isolating. The other thing that helps us in our community is that our providers are fantastic at reaching out to the health department and providing information, our concerns, and asking questions, hence why we also want to have all these nurses available to those offices immediately so we can support them as well. So I'm not sure what New Mexico, but
Yeah, and it's not just New Mexico either. There's others that are springing up way past us that are roughly equivalent, I think. But
and one thing I think that could be happening, I don't know, is that if some of those sites have, areas have community-acquired cases,
Yeah.
and perhaps CDC has opened up the testing there and not doing the requirements we have. That's one of the things that comes to mind in looking at
that
thinking
would
about
make a lot of sense. Yeah.
Thank you for being on top of this and giving us good and accurate information on a daily basis. I've been watching the press conferences, but also, as Deb indicated, I tell people to go for this local information because it's coming out in a way that people can take it in and be very practical. I think people are getting flooded with information at the federal level, and it's very scary and not knowing where to go. So I appreciate all that you and your staff are doing, and take care of yourselves because we need you.
Thank you. But thank you for your support. It has meant a great deal to all of us to be in a situation where we have a community where we can go to our elected officials and their commitment to the public. And I think that's important for the people who live here to really be grateful. That's not the case everywhere.
And
We're
Pat,
here
I
for-
actually,
I'm sorry, we're here for anything additional you might need.
Absolutely.
and Pat, I really, you have done such a tremendous job in working with this and in presenting the information. You have such a calming influence, and you're very calm, cool, and collected, and I think that that's exactly what we need. You have a vast amount of knowledge concerning this, and we just appreciate you so very, very much. Thank you.
You're doing a wonderful job, and
Well, that goes
Frankly-
both ways. Thank you.
I'm glad you're stuck in that job.
And I
Inside
can't
joke.
walk away without saying this. And most importantly, the only reason that I do is we have a great team.
Yes.
You have great professionals that are very skilled and knowledgeable, and our community is very fortunate to have them, as I am.
That's a great note to end on. I move we adjourn.
Second.
We have a motion for adjournment and a second. Is there any discussion? Please call the roll.
Shore,
Yes.
Amundson,
Yes.
Yocum,
Yes.
Best,
Yes.
Flowerday.
Yes.
Motion carries 5-0.
I need to sign this.